Welcome, everyone. Today, we're going to peel back the layers on a really fascinating neurological symptom called chorea. We're going to dig into the precise biochemical breakdown that actually leads to these uncontrolled movements.
So, here's our game plan. We'll start by defining chorea itself, then take a look at the brain circuits that are supposed to control our movement. After that, we'll see how that delicate balance is kept in check, what goes wrong in something like Huntington's disease, and then finally, we'll trace the exact biochemical chain reaction that causes the symptoms.
All right, first things first, what exactly are we talking about when we say chorea?
At its absolute core, chorea is all about these unwanted, erratic movements. You can see why it gets its name from the Greek word for dance. It can look like a person is dancing or fidgeting uncontrollably. These are movements that are rapid, they're unwanted, and they're just unpredictable. But these dancing movements are rarely the only sign. Chorea is often just one piece of a much broader clinical picture. It can really affect so many aspects of a patient's life, from basic motor control all the way to their cognition and even their personality.
So the big question is, where in the brain does this all start? Where does this loss of control come from? Well, let's meet the main players in our story, the basal ganglia.
Okay, so this collection of structures is tucked away deep in the brain, and it's responsible for what the slide calls the automatic execution of learned motor plans. Just think about walking or riding a bike, stuff you do without even thinking about it. The basal ganglia acts like a super sophisticated gatekeeper, basically streamlining the signals that let us move smoothly and with purpose.
Now to pull this off, to control movement, the basal ganglia uses this brilliant system of checks and balances. And it all operates through two main circuits.
The easiest way to think about it is like driving a car. You've got the direct pathway, which is your gas pedal, basically saying go. And then you have the indirect pathway, which is the brake pedal, saying stop or slow down. For any normal movement to happen, you need a perfect, delicate balance between these two.
Now here's where it gets really interesting. The gas pedal doesn't just push go. It works through this super clever process called disinhibition. It actually inhibits an inhibitor. So the striatum releases GABA, our main inhibitory neurotransmitter, onto the GPI. Since the GPI's whole job is to put the brakes on the thalamus, inhibiting the GPI is literally like taking your foot off the brake. That frees up the thalamus to excite the motor cortex, and there you have it, movement.
Okay, the indirect pathway, it's a bit more complex, right? It's got this extra player, the subthalamic nucleus. But the crucial takeaway here is that its final output strengthens the GPI's brake on the thalamus. By going through this extra loop, it's basically telling the GPI to push down harder on those brakes, which is what prevents all sorts of unwanted movements from ever happening.
So that's how the system is supposed to work. But what happens in a condition like Huntington's disease to cause chorea? What breaks?
Well, the disease essentially launches a targeted attack on the very structures that house our two critical motor pathways. This cell death, this neurodegeneration, that's the root cause of the entire system just completely failing.
And wow, this image really shows you the devastating physical impact. Look at the Huntington's brain at the top compared to the healthy brain below. You can see that profound tissue loss and how the ventricles have enlarged to fill the space. Just notice how the striatum, which is a key part of all this, has basically been hollowed out. It's really stark.
Now, this is the crucial point. The disease isn't random. It doesn't attack everything at once. It has a preference. It first goes after the GABAergic neurons. Those are the ones that use the inhibitory neurotransmitter GABA that make up the brake system. So think about it. The brake pedal is the very first part of the system to fail, and that just throws everything completely out of balance.
So, let's trace that final biochemical cascade. Let's see exactly how this specific damage leads to those uncontrolled movements of chorea.
This quote from the research really makes the connection explicit. It's saying that hyperkinesia, which just means excess movement, and chorea are directly caused by damage to that indirect pathway. It's a straight-up cause and effect. No ambiguity there.
So here it is, the whole chain reaction. It's like someone literally went in and cut the brake lines. Because that stop signal from the indirect pathway is gone, the GPI's inhibitory signal on the thalamus becomes incredibly weak. The thalamus is now basically free to fire like crazy to the motor cortex, and that triggers this storm of involuntary choreatic movements. So, to put it as simply as possible, the brakes are broken. That leaves the gas pedal, the direct pathway, completely unopposed.
And this imbalance, this is the fundamental biochemical reason why patients develop chorea. The very system that was designed to prevent unwanted movement has been selectively taken apart, leaving the GO pathway to just run wild.
Understanding this mechanism isn't just some academic exercise. This is the foundation for how we develop future treatments. By knowing exactly which part of the brakes are failing, researchers can start to design therapies to try and restore that balance. And that's why understanding the why, right down to the biochemical level, is always the first and honestly the most critical step. So we'll leave you with that to think about.